We'll be seeing this video on local stations very shortly. We believe this is an historic day for Southwest Florida and the NCH Healthcare System. Today, we announce a clinically significant collaboration between NCH and the most respected and recognized healthcare system in the world, the Mayo Clinic. I am joined in this important announcement by our NCH Chairperson, Mariann MacDonald, Dr. William Rupp, who's Chief Executive Officer of the Mayo Clinic in Florida, and Dr. Stephen Lange, Southeast Medical Director of the Mayo Clinic Care Network. We have all been proud of the achievements of NCH these past 6 years in terms of clinical quality, patient service, and financial strength. These successes have been due to an extraordinary team of 4,000 colleagues, 600 physicians, 1,200 volunteers, and most importantly, a very supportive community, many of whom are with us today. We take the next significant step in our journey today. This relationship, which we have been discussing and evaluating for several years, and about which Dr. Rupp and Dr. Lange will elaborate, will bring a new level of healthcare knowledge and expertise to Southwest Florida for patients, physicians, and our community. We are proud that NCH is the first hospital in Florida and the first in the Southeast to be selected as a Mayo Clinic Care Network affiliate. The foundation of our collaboration is a shared philosophy, commitment, and mission to improve the delivery of health care through the use of best practices and evidence-based medicine. Now, what does this mean for our community? The primary goal of the Mayo Clinic Care Network is bringing the benefits of Mayo Clinic expertise close to home, decreasing the need for patients to travel outside of Southwest Florida for treatment. 1 in 8 NCH patients already comes from outside of our 5-county region. This alliance will not only improve the quality of our care here in Naples, but also serve as an economic boost for our community. As patients and their families travel to NCH for care, they will use our hospital services and other local services as well, potentially contributing to real estate and development if they decide to stay or need further care here. For NCH physicians, this collaboration gives access to the Mayo Clinic service called Ask Mayo Expert, which delivers a concise, Mayo-vetted medical knowledge at the point of care. This new knowledge base will be an educational resource for our physicians and assist them to provide the best care ever. The NCH Healthcare Pulmonary and Critical Care physicians and the Naples Heart Institute physicians will also have access to Mayo's eConsult, an electronic tool that directly connects our local healthcare provider with a Mayo Clinic specialist. These consultations, by the way, will not add any additional costs to our patients. In other words, a true win-win. And we'll not stop there. In time, the access to eConsult will be broadened to include additional medical staff specialists. Most importantly, for any patient in Southwest Florida, this new relationship means deriving the benefits of Mayo Clinical experts close to home. Our ultimate goal, and the most important reason for this collaboration with Mayo, is to help Floridians live longer, happier, and healthier lives through access to the highest level knowledge and expertise. We are excited about this collaboration and optimistic that it will usher in nothing less than a new era of healthcare in Southwest Florida. Now I'll ask Dr. William Rupp, CEO of Mayo Jacksonville, who with his team worked closely with us these past few years, to share his thoughts with us. Bill?
Thank you, Dr. Weiss. We at Mayo Clinic are honored to be here at NCH today to announce that NCH Healthcare System is a member of the Mayo Clinic Care Network, the first member of the Southeast region of the United States. Collaborating with others to provide the best care for patients has always been at the heart of Mayo Clinic culture. And through the Care Network, Mayo Clinic and NCH are formalizing a relationship that recognizes our mutual goal: promoting physician collaboration to improve the delivery of healthcare to our patients and our communities. At Mayo Clinic, we value teamwork, It is one of our founding principles to best serve the needs of our patients, and our collective approach to patient care has distinguished Mayo Clinic for nearly 150 years. Mayo Clinic values sharing knowledge. The Mayo Clinic Care Network takes this a step further by developing more formal connections with high-quality, culturally aligned hospitals and physicians to share our experience and expertise collaboratively. We value enhancing healthcare close to home communities. Building a closer relationship with NCH through the Care Network provides an opportunity to work together in new ways, which ultimately enhances the lives of our patients. Through the Mayo Clinic Care Network, we are honored to associate with healthcare providers like NCH, who share our values and are interested in working with us to promote high-quality, data-driven, evidence-based medical care and treatment. And through these meaningful relationships, we'll collaborate to create a connected network of hospitals and physicians that focuses on the patient and the delivery of best care to the patient. We're proud to welcome the entire NCH team to the Mayo Clinic Care Network.
Thank you, Dr. Rupp. I'd like to introduce Dr. Stephen Lange, who is the physician head of the Southeast Mayo Clinic Care Network. Dr. Lange.
Thank you, Alan, and good morning to everyone. It's truly exciting to be here today. After almost 15 months or greater of continuous conversations and then a very rigorous due diligence process, we have come to know a great deal at Mayo Clinic about NCH Healthcare System. We're confident that our two organizations share a common value system, commitment to the patient, and mission. I think it's important to also note that Mayo Clinic is consistently impressed with the high quality of care that is already delivered in this community through NCH Healthcare System. But the future presents new and unique challenges. Healthcare reform is coming, and it will force us to change how we deliver care. Leadership is going to be held accountable to make certain that the knowledge available is at the bedside, so every patient gets the same level of care each and every time. The leadership at our two organizations through the Mayo Clinic Care Network recognizes that in a collaborative relationship, we can better meet these challenges. Let me make a few specific comments about the core offerings of the Mayo Clinic Care Network. First, we see this collaborative relationship as an exchange of information in both directions. We believe both organizations will improve through this relationship. Quality of care will improve on both campuses. Second, the core offerings are scalable. By that I mean we will continue at Mayo Clinic to invest in these core offerings to make them more applicable to the physicians in this community. In addition, we'll invest in developing new core offerings. As new knowledge is developed at Mayo, vetted, proven to be our best practice, we will share it with our members within the Mayo Clinic Care Network to see if it is applicable in their community. Finally, Mayo Clinic has no plan within the Mayo Clinic Care Network to build buildings or deploy staff in the community. Our core goal within this initiative is to support the providers who are here, to help them refine and expand their current services and actually develop new services that should be available in this community. We're truly excited about this relationship, and Al and I look forward to getting the work done.
Now it's my pleasure to introduce Mrs. Mariann MacDonald, who's the chairperson of the NCH Healthcare System.
Thank you, Alan, and good morning to all of you. It's so nice to see so many of you here and so many familiar faces. You've heard from Dr. Weiss, Dr. Rupp, and Dr. Lange about the clinical significance of this collaboration to our community. Now, let me just add the non-medical point of view, because I'm not like those guys. So, I'm someone who chairs the NCH Healthcare System Board and represents nearly 24 community leaders from that board. On behalf of all of them, let me just say that we are so pleased and proud to be chosen as the newest member of the Mayo Clinic Care Network. You know, for quite some time, the NCH board has focused on three things. We focus on the quality of care, we focus on the value of the healthcare investment, and of course we focus on the satisfaction of our patients. Each of those three critical areas will be enhanced by the best practices that we adopt as part of this partnership. Another objective of our board has been to improve the local care to the level of our patients. And we want them to choose to be treated in our community rather than traveling to remote healthcare facilities. As the doctors indicated, as part of the Mayo Clinic Care Network, the NCH physicians will now have access to the knowledge and expertise of over 3,000 specialists from all three Mayo Clinic locations. We are invested in taking care of our patients, and this translates into benefiting from enhanced care locally and only needing to travel outside of the region when absolutely necessary. This affiliation will also lead to other benefits for our community. As part of the Mayo Clinic Care Network, the NCH team can access electronic care reference and collaboration tools and connect directly to the Mayo Clinic specialists. They'll also have access to Mayo's latest research and treatment recommendations. NCH's primary mission remains to promote, maintain, and restore the health of those who reside in Collier County. Stated another way, and I know you all know this is my hospital, and that will still remain our guiding theme. Even with all these benefits of this formal relationship, NCH continues to remain an independent, local-based provider responsive to the needs of the community that it has served for 6 decades. I was going to say older than me, but that's not true. No laughing. Today is just the beginning. We fully believe that by working together over time, NCH and the Mayo Clinic will build new and innovative ways to provide the best possible care for our patients and their families in the community. Dr. Weiss called this a win-win for our patients, our families, and for our community. And on behalf of all of the trustees of the board, we couldn't agree more. Thank you all for being here, and I guess I hand the mic over to Dr. Weiss. There you go.
Alan, on behalf of all the staff of the Mayo Clinic, it's my privilege to present you this commemorative memento for joining the Mayo Care Network. You're the first member within the Southeast and within Florida. It's truly a privilege to have you join us. The plaque reads, Mayo Clinic Care Network. Mayo Clinic welcomes NCH Healthcare System to the Mayo Clinic Care Network.